Well, let's wrap up this conversation with the dysfunctions, the disorders that affect both sexes. So this first one is called hypoactive sexual desire. They used to call it inhibited sexual desire. There's different names for it. Sexual desire disorder is another alternative name. The idea here is that you have a low level of sexual interest, and that results in a failure to initiate or respond to sexual intimacy. Now, laid on top of that is a persistent or recurring lack of desire or an absence of sexual fantasies. If you recall back when we talked about sexual behaviors and we talked about sexual fantasies as a really important sexual behavior, even if a person doesn't have a sexual partner and doesn't feel comfortable masturbating, maybe they probably have sexual fantasies. If that is absent, it's possible that the person might be experiencing hypoactive sexual desire. Now, it can be a primary hypoactive sexual desire, which is where the person has never really felt much sexual desire, if any, their whole life. Now, it's really important to mention, I'm talking about adults, by the way. So you wouldn't diagnose somebody who's 12 with this disorder, right? This is when you have reached full maturity, and, typically we would expect that, sexual desire would be part of that healthy functioning. Secondary hypoactive sexual desire is when this lack of interest is something new, that the person used to have interest, they used to have sexual fantasies, they used to initiate or respond to sexual intimacy, but now they don't. Like something has changed. Now, I know that, along the spectrum of different sexual orientations is now listed asexual, and some people say that that's their sexual orientation, that they just aren't interested in sex or sexual behavior. They don't have sexual fantasies because they're just not interested in that. And so there are two ways of looking at that. And, it's up to an individual to decide whether their own experience is a symptom or just the way they are, right? It's just generally to be diagnosed with any kind of psychological disorder, it has to be distressing either to the person themselves or other people are distressed on their behalf. And so I'm going to use the example of schizophrenia as a good example of that, because the person who is schizophrenic might not be as bothered by their symptoms as the people around them are. And so now if we transition that over into a discussion about sexual desire, if you have a person who has in the past had sexual desire and is in a relationship with somebody with whom they have had sexual acts and had a satisfying sexual relationship with before, you can imagine that even if the person now is not concerned at all that they're not interested in sex, their partner might be, right? And this could be a big, major impact on the partner's life. So it's not always just about how it affects the individual. It can also be about how it affects the people around them, their partners, maybe their relatives who are concerned for them that they don't seem to be, maturing into sexual desire, right? So if you have a person who has the primary type and they've really never had much sexual desire and, they just don't seem to be interested in it, their family might be encouraging them to maybe get that checked on. And the person might say, don't tell me to get it checked on because this is just how I am, right? It's possible that that's just how they are, but it's possible that it could be a symptom. So what could cause hypoactive sexual desire? Well, depression or anxiety. I mean, really, sexual functioning is dependent on us not being in a major depression or experiencing clinical anxiety, right? So this could be, just like the other ones I've talked about, could be a symptom of one of these disorders. Maybe the person had sexual desire in the past, but now they're not expressing that because they, in fact, are having difficulty in this relationship, right? Something's going on and they're dissatisfied in some way, shape, or form. And this is actually a symptom of what's going on in the relationship. It could be that they had sexual desire before, but then some kind of sexual abuse has happened, and now they don't want to have those feelings anymore. And so they basically have, made them unconscious, and it's not something that they want to deal with. They don't want to have to confront things like that. Again, if you are in a culture or a religious situation where the things that make you aroused are not valued, that can make you in general not responsive to any sexual activity. Maybe I just would like to not be interested in sex because I don't have reliable birth control and I don't want to get pregnant, right? So that could be a motivator. And then, of course, being under stress can cause, you not to be able to get into that parasympathetic nervous system side of your brain that would generate excitement and arousal that could lead to, sexual behavior. And then on the bottom of the list, I have the fear of rejection, that a lot of people kind of stuff down their sexual desire because they are afraid that if they were to initiate with someone that they would get rejected. Now, it's easiest to think about that with regard to somebody who's single, right? Like getting out in the dating world and trying to find a person with whom to have sex. I mean, they might get rejected, and so just never mind. But it can also happen in relationships where a person keeps suggesting that the partner have sex with them, and the partner keeps saying no. The partner doesn't feel good today. The partner is too busy. The partner, blah, blah, and that ultimately makes the initiator feel rejected. So it could be that the person's just like stuffing it down because their partner makes them feel unattractive, undesirable, things like that. Now, biologically, things that a person who maybe has never had any sexual interest might want to get checked just to find out if maybe this is a symptom of something biological would be medical conditions like some of the ones that I've mentioned before, diabetes, major depression for sure, things like that. It could be their hormone balance is out of order for their sex. And so they may discover that actually if we treat that, then sexual desire comes back. Certain kinds of medications can cause hypoactive sexual desire. And so this would typically be the secondary type, right? Where you start taking the medication and you lose your sexual interest. But these are things to get checked on if a person is not experiencing sexual desire and they're a fully developed adult. They might have a biological condition that needs to be checked on. So treatment psychologically, familiarization with the body again, because if a person's not really reaching orgasm, if a person doesn't feel secure about their sexual, functioning, stuff like that, they may actually just sort of not want to have sex. Really, sensate focus works really well. It's not about having coitus. It's about enjoying each other and things like that. And it can really bring back a lot of desire to sort of return the person back to those, youthful days when they were full of so much passion and desire, especially a person who's had secondary hypoactive sexual desire. And then in couples therapy, we always have that issue that it could be something going on in the couple. Guided masturbation and Kegel exercises, the addition of lubricants, that everything is much more pleasurable. And then suddenly a person may become more interested. So there are a lot of things that can be tried, whether it's, primary or it's secondary, whether it's a person by themselves or a person in a couple. There might be different reasons for these feelings. And so what I would like to suggest to people who are listening to me talking about this is that I wouldn't want to go really quickly to labeling it based on something that other people on the internet or whatever are talking about. I would want to make sure that a person is exploring the biological possible causes as well as psychological causes so that they're making sure that this isn't just actually a symptom of something. All right. This is our last disorder. Hardest one to pronounce, Dysparunia. Yeah. It means painful intercourse. It could be that it hurts just during penetration. It could be that every time anything penetrates the vagina, it hurts, even a tampon. It could be that it's new pain after previously pain-free intercourse, or the alternative being you've been having pain every single time you've ever had any kind of intercourse. It could be deep pain up in the pelvic region during thrusting. It could be a burning pain or an aching pain, and this could apply to the penis or to the vagina. Number 1 can also apply to penises or vaginas. Number 6 could apply to penises or vaginas, throbbing pain lasting hours after intercourse. And it's not just penis or vagina. In this case, it could be things, the testicles hurt, or deep inside the man's pelvis, it could hurt, and that could be his prostate. Or in the female, it could be her vagina. It could be deeper in her. It could be her uterus that's making that pain, or her ovaries. So lots of things that could hurt, could get jostled. Pain at entry oftentimes will be attributable to skin-related things, right? So maybe there's chafing or sensitivity to the lubrication or the spermicide that's being used. I mean, there's a lot of different things that could be going on here. So let's talk about those. All right, so we're going to have the idea that psychologically, these same things that could cause vaginismus or could inhibit orgasm in either sex can actually cause some pain during sex also. But most of the time when we're talking about dysparunia, we're talking about some kind of biological cause, like medical conditions, like tipped uterus can be really painful when you're having coitus face to face, especially man on top. It's more likely that the penis will actually hit a tipped uterus than it is that a penis would hit a normal front-oriented uterus. So doggy style might be the cure to the problem, right? I'm sorry, rear entry. Sorry, I got non-medical there for a second. So a tipped uterus could be one of the medical conditions that could cause painful sex, and deep in the pelvis, you could imagine. Insufficient lubrication could hurt both the penis and the vagina during thrusting. Trauma to either person's pelvic region. It could be infection. It could be having had an accident that, harmed the internal organs or the bony structures of the pelvis. Skin conditions. Some people have very sensitive skin. Some women are actually allergic to semen, and that can cause very painful sex whenever they have ejaculation. Now she has semen inside of her, and she's actually allergic to it, and it's giving her like a bad reaction. Congenital abnormalities where the structures are not typically where they would be, and so different things are hitting each other than are supposed to be hitting each other. And it could just be the way that the bodies are designed. And so, a penis that tilts to the right, or, different kinds of things. And so, changing positions, trying something different, oftentimes will get around a lot of these biological causes. So psychologically, all my standard repair work, and you can see how, familiarization would help, and all these things might help. But biologically, guided masturbation so that the person gets familiar with their own body. If they feel with their own hands what their body structures feel like, that might help. Kegel exercises so that we can get good strength in the especially for the vagina, going to be really helpful. Adding lubricant. All of these problems that affect both sexes or females, we're going to throw in lubricant will probably help with this. So I don't own stock in a lubricant company, but I would like to suggest ones that are longer lasting and not KY jelly can get tacky pretty quickly. There are other things on the market like Slippery Stuff is one brand, or Astroglide. You want to stay away from petroleum-based products because they eat latex. And so if you put lubricant on the vagina that has petroleum based, and then you have a condom, the condom's going to get eaten away during thrusting. So you don't want to use petroleum based products. You want to use water based, but some of them are better than others. So you want to make sure that you're getting water based that doesn't get tacky. All right, that's my tips on how to buy lubricant, and hopefully this list of different problems and some of their solutions helps you to think about things that could maybe be enhancing for sexual contact, or things that maybe are things that need to be checked out. things like that. So I will see you guys in the next topic.